Today I want to talk to everyone about our healthcare system here in America. Well, one thing a lot of people don't realize is we actually don't have a healthcare system in America. We have a health insurance system. I want to compare and contrast the health insurance system that we have here in America with the program that I plan on pushing, which is a single-payer healthcare system. Now, when we're analyzing healthcare, we're going to look at it through three lenses. The only three lenses that even matter when we're talking about healthcare. The first is coverage, how many people are able to receive these benefits. The second is cost, how much is it costing out of both our federal budget as well as the American individual's bank account, so how much do people out of pocket have to pay for these expenses. Third, and most important, is outcomes. How fantastic are American outcomes in comparison to other systems, specifically the single-payer healthcare system. Starting off with coverage. Now, there are 32 industrialized countries in the world. The 32 or 31 other industrialized countries have a version of single-payer healthcare. So, we're going to use them as a reference. Now, in terms of coverage, we know the goal. The goal is 100% coverage. Everybody has access to healthcare. Now, in America, we do not have 100% of our population that is covered under health insurance or under Obamacare. We have around 90% of our population that is covered. Now we're going to compare this with a local country that has a single-payer healthcare system, which is Canada. Canada has 100% of its population covered. If you are a citizen of Canada, you walk into a healthcare clinic, get the healthcare services you need, and then you go home. America has health insurance. Now, this does not mean that that insurance covers the needs of those who require it. Sometimes the health insurance doesn't cover a bill that you need, doesn't cover a procedure that you need. 45,000 Americans die every single year because they do not have health care of any kind. 0 Canadians die because they don't have the health benefits that they need. 0 Englishmen, 0 Frenchmen, 0 Italians, 0 Germans die because they don't have health insurance. Especially when we're looking for coverage, remember what the goal is. The goal is 100% coverage. In terms of coverage, where does America stand? Well, it would fail. 45,000 people dying every single year, that's a failing score. Whereas when you look at other countries around the world that have a single-payer healthcare system, one of the biggest recipients of foreign aid and domestic aid for health insurance and health coverage and health benefits in general is America. One of the things that people don't realize is, for an industrialized country, we require a lot of outside volunteer aid, foreign aid, to be able to make sure our people are able to get the health care benefits that they need. Now let's take a look at the cost that Americans have to pay in comparison to other single-payer systems. Look at this first graph and you will see Americans pay the largest amount in the world. It's no small margin too. Take a look at this next graph. This is the Consumer Price Index. So, this is where we're going to talk about how policy over the last 20 years has done absolutely nothing to slow down the cost of healthcare. That red line beaming across the center of that graph, that's healthcare costs. And as you can see, over the years, despite Obamacare, the Affordable Health Care Act more accurately, despite any legislation that has been made over the last 20 years, it's still skyrocketing upwards. One of the reasons why American healthcare is so expensive is because it's a multi-payer system that's protected under patents. That doesn't happen in other countries, because other countries have complete control over the prices. That country says, fine, that pill is acceptable, it meets our standards, we'll pay $3 a pill for it. You go to America, you try to do that, it's impossible, because it's a multi-payer system. If you were to say, we'll pay $3 a pill, they can laugh you out and say, no, we already have these other organizations that are willing to pay $17 for the pill. And because doctors, hospitals, pharmaceutical industries all work for each other and with each other, they're going to work to make sure they're getting the best profit out of it. So therefore, in America, you see, with a multi-payer system, skyrocketing prices, just larger than any other country in the world. America spends on their federal budget about $1.1 trillion a year on health care. Now that is an astonishing almost 30% of our overall federal budget is spent on healthcare. Compared to other countries that are spending more along the lines of 15%, we're spending a lot of money on healthcare. In the steps towards creating these medicines and all these prescriptions that we need, they always start with public funding. The taxpayers, we fund the research that makes these pills possible. But then we give them to a private organization who sells it back to us at an astonishingly higher price. Cut out that middleman. If we're going to be taxpayer funding the research, why don't we taxpayer create the pill? Manufacture the pill ourselves. Cutting prescription drug prices, as well as cutting administrative costs, can diminish our $1.1 trillion budget on healthcare by upwards of 30%. 30% is no small number. It's 1/6 of our economy. And it is getting so big that it is absorbing the wealth and profits from other necessary aspects of our economy. It's failing our businesses. It's putting our people into bankruptcy. It is destroying and sucking the life out of our society. We can manage costs and have full control over costs. We just need to have a single-payer healthcare system. Now we're going to talk about outcomes. If we are making sacrifices for coverage and sacrifices for expenditures, then we clearly must have the best outcomes in the world. Well, that is unfortunately not true. At the same time as our health outcomes are poor, so is the overall health of Americans, with Americans being number one in one category, which is diabetes. Heart failure is rampant in comparison to other countries, as well as many other health-related issues. Not only are our people not able to receive the healthcare benefits that they need, but the climate that they are in are causing them to be drastically more unhealthy than they would otherwise be. Health education in America is incredibly low, especially in comparison to almost all other countries. Our population is simply not equipped with the knowledge that they need to be able to take care of themselves and to be able to understand what foods cause what diseases, what diets cause what health outcomes. When you mix a poorly educated population as well as incredibly high healthcare costs, you get a relatively unhealthy society. When you go down the list of healthcare outcomes in comparison to other countries, America is consistently finding itself at the bottom of the scale. So, I ask you, why would we continue with a healthcare program that does not cover 100% of the citizens and is failing at that? Costs more than any other healthcare system in the world, has some of the worst outcomes of any industrialized country in the world. When you fail in the only three categories that matter for healthcare, you can easily conclude that that is a failed system. A single-payer healthcare system fixes all of this. Because in terms of health outcomes, the only job of a single-payer healthcare system is to have the best possible outcomes we can have. When you have a system that we have now, that isn't the ultimate goal. The goal is not to have the best healthcare outcomes we can have. Is to have the most profits you can possibly have in a healthcare system. That's the goal of our current system. We need to change that strategy. We need to change that moral structure by creating a single-payer healthcare system.